Cardon Children's Medical Center, providing comprehensive pediatric care for Arizona's families.
Sam is almost 15 months old. He is really a fun, bright kid. He into everything these days. Some of the things I worry about with Sam around the house would be him getting into the cabinets under the sink and, you know, tripping and falling and possibly hurting himself, or having some other type of accident, eating a rock when he's in the backyard, which is one of his favorite pastimes these days, is putting things in his mouth that, you know, he shouldn't probably be eating. So.
I'm Dr. Joseph Winchell. I'm the Emergency Medical Systems Medical Director at Banner Desert Medical Center and Cardon Children's Medical Center. It's important with families, with every household, to have a basic first aid kit, especially with children of all ages. Accidents do happen, we're all aware of that, and if we're prepared for these simple household accidents, at least we could address the initial injury right off the bat, and buy some time until, you know, we could until the patient or the family member could seek medical care. One of the most important aspects of a basic first aid kit is a cold compress. The initial body's response to injury is inflammation, and if we could reduce inflammation by compression as well as cold compress, that would help the healing process, and it would help prevent any further injury. You also want to secure that with an ACE wrap. An ACE wrap helps to compress the cooling item to the injured tissue, which helps reduce the inflammatory process. Another key issue that we see, complication from a household injury, would be infection. These infections could occur from injuries that occur outside as well as inside the home. The immediate irrigation of the wound, as well as the application of any type of antibiotic ointment or solution, would at least help prevent the likelihood of this wound or injury becoming infected. Once the wound has been protected with antibiotic ointment, as well as covered with a simple gauze pad, or in some cases with larger wounds, we use an ABD pad or a thicker gauze pad. You want to secure the wound with simple tape. Tape could be a plastic tape or a paper tape. Usually paper tape, like this one you see here, is better tolerated because it has less adhesive, and therefore it'll cause less irritation to the skin itself. Another item that we see sometimes very common in first aid kits are medications. One common mistake that we see in a situation where there's emotions and people are scared and worried about a fresh injury is maybe we're not thinking quite as clearly as we should. And it's sometimes common to give the wrong medication and to give the right in a certain situation, or maybe give too much. Any medication can be deadly, even simple Tylenol. What we recommend is these medications do have a place in the home. However, these medications should be in a secure area where only adults have access to, and there's an ability to think before the delivery of this medication, to thoroughly read the labels and know that we're given the right medication for the right situation. One common item that you see in a first aid kit, you may find a burn cream that is included in these kits. Actually, what we recommend for the treatment of any burn on any part of the body would be simply applying cool compresses, cool wet sheets, any item that is cold and wet with just simple water and applied to the affected area would be the best treatment. Unfortunately, when these wounds are treated at home with creams or paste, the first thing that we have to do in order to address the wound or the burn in the hospital is clean these wounds off, and that could be very painful to the patient. As opposed to the proper treatment would be just the application of simple cool compresses moistened with just simple water. One would protect the freshly burned skin, but also allows us to adequately address the wound and the severity of the injury and apply the appropriate treatment while in the hospital.
I did not have a first aid kit in my house, so I'm very happy to have one now. Probably make life a little bit easier, make my mind rest a little easier, knowing that if he does have an accident, I'll be able to help him. It's a nice thing to have.
work closely with our fire department and police department personnel in adopting the appropriate care and treatment of patients prior to the arrival of the emergency center. And we're able to intervene in a timely manner and deliver the appropriate care. We see their immediate response. In our pediatric population, we see a lot of sick children, and these sick children respond favorably to our interventions. And you see one child that may be very critically ill, and with the appropriate interventions, you made a significant difference in their life, but also in the family's life. And seeing their satisfaction when we could get them through this tragic time and help them has been very rewarding. I wouldn't trade my position for the world.